It's a good question that we don't really have a great answer to. It was discovered in the 50s by surgeons who were treating tremor that when they were working in the brain and listening to the electrical activity, if they would pass a little bit of current with someone who had tremor, the tremor would stop right then. So we knew that electrical current in the brain had effects. And then a neurosurgeon determined about 15 years ago that in one particular area of the brain, if he would stimulate, he could help the Parkinson's symptoms.
Now, when you insert that into the brain, what portion of the brain does it go into?
The subthalamic nucleus.
The subthalamic nucleus.
Yes.
Where's that located?
Below the thalamus. Subthalamic, which is deep. If you look basically from where
How do
those
you
two
get in
lines
there?
intersect, it's surgical, and you have
You
to
drill a hole?
Yep.
And where do you go in?
The incision is in the front, and it's done in what's called a stereotactic frame, which allows us to be very precise about where we place it.
Sure.
And while we're in surgery, the patient is awake, and we actually listen to the electrical activity in the brain, and that helps guide us to get to that nucleus.
Now, the wire then passes under the scalp on top
Yes.
of the cranium and comes around down the neck, and then the piece
On the chest
is
wall.
put on the chest wall. So there's no, you can't see it,
No,
you can't feel it really.
No. Once it's in place, it's okay.
Is life expectancy affected by an individual having Parkinson's?
A little bit, but not dramatically in terms of longevity. Quality of life is what's affected.
What do you think people who have Parkinson's find most challenging relating to the change in the quality of life?
I'm going to let you hear the patients. I hear the surgical side. I'll let you tell the patient side on that.
Most challenging to the quality of life is their self-consciousness about the changes that people are seeing. The tremor, the difficulty with walking, the freezing, the inability for them to go from point A to point B. Many complaints are that they can get to the grocery store, they get halfway through, all of a sudden their meds are slowing down, they're not working anymore. After 5 or 10 years of using Parkinson's meds, they don't always work like they once did. And they're sporadic. They'll work really well, and then the patients get the extra movements. They start to slow down. The patient gets frozen. The patient gets a little anxious. They freeze. They can't get out of the store. So it's more of a social thing, and that's why all these social support activities that we have outside of the hospital, I feel, mean so much to the patient, because they become very isolated.
Pat, you have a beautiful picture that I'd like you to show to our audience and explain what it is.
Sure. We asked the patients of ours at our center and also in the community at our Parkinson's Wellness Group to draw a picture of themselves to show awareness and support of patients with Parkinson's disease. And if you look very closely at the tulip is the symbol for Parkinson's disease, the red tulip. There are tiny little faces there of people who are somehow affected by Parkinson's, whether they be a family member or a patient, grandchild.
What kind of emotions and thoughts do you have about Parkinson's? Because you're a nurse, you're out there, you're working with people. What are your just general thoughts and feelings?
My general thought is that that is really an important place for awareness with Parkinson's, because it's not well understood by most people. Many people who get Parkinson's and they're young and they're still working, it's almost difficult, it's so difficult for their employers to see what they're going through and how they just can't get through their workday. But if you look at them, on most occasions they look fine, but they're struggling with a lot of slowness and medicine's not working well. And so that part of it, and the other part that bothers me is I often wonder how many patients are home and not coming out and getting the support that they need. They're embarrassed, they're very self-conscious about the way they look, their difficulty with walking, they're shaking, they can't go out to dinner anymore because they're dropping food everywhere, or if they get into the restaurant, they can't get out of the restaurant. And how many of them are isolated and not sharing all this difficulty with anyone and just becoming more and more depressed?
When we come back, more on Parkinson's disease and how you can access support in the Buffalo area. We'll be right back. We're back with more key information on Parkinson's. Dr. Plunkett, if you could, let's talk again about the two things that you're working on and that Pat's working on in this community?
Sure. We treat patients at the Comprehensive Movement Disorder Center. We actually take care of patients, do the surgery, all of the things that could be done medically, we do.
And that's affiliated with which
Buffalo
hospital?
General Hospital.
Oh, it's Buffalo General
Buffalo
Hospital.
General Hospital. The second part I'll let Pat describe to you, but that's our outreach function. That's not just the patients that we treat, but anyone in Western New York with Parkinson's who we can provide information and support.
So our goal would be to have every patient educated on their disease so that they can work with their physician and minimize their side effects and maximize their quality of life. So if someone was newly diagnosed and they're with their community physician, that's wonderful. But if they get to a point where their disease gets difficult and difficult to understand, they could call our center and speak to myself or our social worker. I have these colorful booklets that educate on every aspect of Parkinson's disease, and they're provided to us by the National Parkinson's Foundation, of which we're an outreach center.
What does the onset of the disease curve over time look like? How many years does it take for somebody who has Parkinson's to realize they even have Parkinson's, and then what's the timeline look like?
Let me understand. I realize that they have it. From what I hear, patients have gone to several doctors and don't always get their diagnosis, especially if they're young. Sometimes takes a while. I would say by the time they get symptoms, it's probably no less than a year before it's definitely diagnosed. Would you agree?
Oh, easily.
So there's people out there today who have Parkinson's and they don't know it.
They may have a shake and they may just think it's a little tremor and
Is there
not
always
sure.
a shake or just sometimes?
Most of the time, but not always.
Most of the time, but not always.
Not always.
Not always.
What would be another thing that you'd see a lot?
Slowness,
Walking slowly, talking slowly.
stiffness of their limbs.
Stiffness of
A lot of
limbs.
old age symptoms where people can be confused at thinking, well, Graham's just getting old. But they don't look into it close enough and realize that it could be Parkinson's.
Now, when we talk about the progression of the disease, I'm sure you go through a progression of symptoms. You start off with this, it goes to this. What's the progression look like?
Over time,
Yeah, 7-year period or 10-year period.
5 to 10 years can be really, really good. And with surgery, it can even go longer. That would be my best answer. What would yours be?
And the time range you described, most patients would have a period in the first few years of being diagnosed where the medicines work wonderfully, and they can go on about most everything they want to do. Then a period of a few years where they can tell they're having to start backing off from some activities they can't accomplish anymore. Somewhere between 5 and 10 years is when complications of the medicines and the disease progression begin to hurt the quality of life. So there's sort of a period where the medicines are terrific, and then there's kind of a slowing down period. But it's different for every patient, but that would be an average.
Okay, let's talk a little bit about National Parkinson's Foundation.
The National Parkinson's Foundation is a group of dedicated people that work with centers across the country to help educate and support patients with Parkinson's disease.
Mm-hmm.
Through them, we have many support services here in our Western New York area. We have 5 different support groups in our area, the biggest one being in West Seneca, one in Niagara Falls, Westfield, Williamsville, and now one at the VA. So each month we have 60 to 90 people meet at our group. We start off with a young onset group, patients in their 40s and 50s that have Parkinson's, some with deep brain stimulators, and we have a group that meets with Dr. Mark Gunther and myself. That's the young onset group. And then we all go into a large room where there might be 60 to 90 people, and we have a medical lecture. We take a break. We have 3 therapists that work with the patients, and then we split caregivers off to another room and we meet with caregivers, myself and Evelyn. And the therapists, I might add that all of us are all trained by National Parkinson's Foundation to give a team approach for Parkinson's care.
For more Medical Matters television shows, go online to medicalmatters.tv.